Hello all, welcome to the iCallify. Hope you all are doing well. My name is Nikunj Kayas and I am working as a team lead at iNetflix Technologies Private Limited. So again, we are back with another excited webinar. As you all know, today we are going to discuss on the evolution of call center software in healthcare. Let me show what are the topics we are going to cover in this webinar. So in this, first I will brief you about what is healthcare. Then I will explain you that how call center services benefits the healthcare providers. After that, we'll explain you about what is telehealth or virtual healthcare. Then we'll discuss about characteristics that a healthcare call center solution must have. Then I will explain you about features which we have in our iQualify product which fulfills the characteristics and the requirements of healthcare call center solution. And in the last, we will have question and answer round where you can ask your queries. So before going into our topic, let me ask you that what comes first in mind when we heard a word of healthcare? Hospitals, clinics, medicines, pharmacy, etc. Right? Definitely, that are all connected with the terms of healthcare. We all have been visited in hospital or at clinic at least once in our life, right? So this is all connected with us, and today I am going to show you that what is the connection between healthcare and the call center solutions. Patient care and healthcare have been the major focus for many developed and underdeveloped countries. Healthcare has been a prime concern in some countries across the world. The pandemic outburst had changed the whole scenario and increased the urgency and need for healthcare in many cases. Distance patient care, such as providing virtual medical consultancy to patients with the mild symptoms and the quarantine at home. This type of shift has shifted how healthcare functions and introduced a whole new branch called the telehealth or virtual health. The healthcare contact center solution with the right features really helps in empowering the whole concept of telehealth. Call centers have been the backbone of various industries verticals. Contact centers not only enables better management of business but also helps in providing better customer service. Undoubtedly, call center services offers an extensive range of benefits to organizations in healthcare, connecting effectively with service providers through multiple channels of communication. Is the key towards implementing better patient experience and the minimizing cost. Optimized call center operations can play a crucial role in the achieving these goals. Now let's start with our topics. Healthcare. Now, what is healthcare? According to the World Health Organization, a health system consists of all organizations, people, and action whose primary intent is to promote, restore, or maintain health. This includes the efforts to influence determinants of health as well as more proactive activities that improve health. A health system is therefore more than the pyramid of publicly owned facilities that deliver personal health services but include the institutions, people, and resources involved in delivering the healthcare to individuals. A well functioning health system working in a harmony is built on having trained and motivated health workers, a well maintained infrastructure, and a reliable supply of medicines and technologies backed by adequate funding, strong health plans, and evidence based policies. Healthcare system differs from nation to nation depending upon the level of economic development and the political systems in place. Healthcare is a priority and the source of concern worldwide. Every country, irrespective of its private, public, or mixed healthcare system, faces challenges with regards to quality, delivery, and cost of services. As with other social institutional structure, there are a wide variety of health systems around the world and tend to reflect the history, culture, and economics of the states in which they evolve. Nations design and develop health systems in accordance with their needs and resources. Although there are common elements present in virtually all health systems. For example, public health measures like vaccination. In some countries, health system planning is distributed within a competitive market of private healthcare providers, while in others, there is a concerted effort among governments, trade unions, charities, religious organizations, or other coordinate bodies to deliver planned public health care services targeted to the population they serve. So, in short, we can say healthcare is a sector which is connected to everyone, and it is the important sector for all individuals and for all the nations. Now, let's move to the next topic. How does healthcare call center software help? A healthcare call center solution will have a various communication features to provide a reliable means of communication between patient and the healthcare facility. The use of an omni-channel contact center solution will add a digital engagement solution to this software. So patients and medical staff can use digital platform to communicate with each other. It saves time and other resources and ensures the first aid or medical consultation is delivered using the flawless healthcare communication solution. There are multiple other benefits of using this software in the telehealth industry and providing remote consultation, medication, and other healthcare services to patients at the right time. In the healthcare industry, each moment is precious, and any delay in medication or lack of reliable healthcare services can create a threat to lives. Thus, this call center software can be used more effectively as it will not be restricted by roadblocks that otherwise come across to visit a doctor at clinic physically for medication. So that's how call center software can help out in healthcare sector. Why call center is very essential for healthcare sector? These days, healthcare providers are becoming more patient-centric, raising the demand for call centers. With a rise in expectation to patient retention initiative, appointment scheduling, and communication with referring medical professionals, the health centers must keep the pace with the new communication technologies. Healthcare providers can extend their unconditional support to the patient by utilizing the services of call center. This would reduce the call volume, resulting more effective care of patients by staffs. Let's see one scenario. Your office staff is busy with patients that are in your waiting room and in clinic. Staff is absent from work. Phones are ringing off the hooks and not being answered in timely manner. Other callers are on extended hold times. Existing patients are getting frustrated trying to reach you, and potential new patients are already getting the wrong impression because they cannot get anyone on the phone. So in this scenario, your hospital or clinic can make a wrong impression on patient and they can go to any other hospital or clinic. Let's take an example as in patient. For an example, you want to book an appointment with doctor but you don't know the clinic and hospital timing, and you try to contact them to know about timing, but they are not able to answer the calls as they might be busy in stuff which we discussed previously. So in that scenario, you will have to wait till the time the staff is getting free to take your call, and in that such scenario you will get frustrated and will try to find another clinic or hospital. So, as an healthcare provider, if you have a lack of systems such as call center solution, it can be made wrong impression over patients. So, by setting up a call center to handle your inbound calls, you can make sure that every calls get answered and every individual reaching out gets immediate assistance. Now, let's talk about contact center technology and hospital management. The level of convenience and the service that is being offered to the patient is different when the healthcare providers use call center software as a part of their practice. Most importantly, patients would always be assured that they have a continuous access to care. Hospital management is a very important responsibility. Therefore, it is very necessary to ensure the smooth functioning of the complete process. Hospitals need to take care of everything from equipment management to the maintenance of record for the minutest details. In this condition, a medical call center can come to the rescue of a hospital, ensuring that all the activities like record maintenance and appointment settings, follow-up calls with the patient, and the reminder for pending appointments. In addition, They can also use email support services for checking up with the patient on a regular basis. Effective care of patients. Customer satisfaction has always been a game changer for businesses. This is applicable for the healthcare provider as well. Providing accurate information to a patient is really important since the well-being of the patient completely depends upon the services they are being provided with. Therefore, automating the complete process can be one of the major requirements that hospitals should take care of. On the other hand, hospitals should also ensure that the personnel employed by a customer service center is completely familiar with patients' needs and have the skills and expertise to address different situations. Bridging the gap between front and back office. Maintaining administrative activity records of patients and prescriptions are often inefficient and difficult to manage. Call center services can prioritize and proactively distribute this work anywhere in the organizations. It also provides business intelligence, so you can significantly improve operational efficiency, meet SLS, and measure the regulatory compliances. Proactive engagement and notifications. Proactive customer service in healthcare is a challenging objective for all providers and physicians, and in spite of their personal commitment and the available technology. There are obstacles when they're trying to move to a proactive health model. Offering customer assistance through multi-channel support via email, text message, or a call minimize interrupted transaction that can be provoke customers to switch to other options available. Besides keeping customer to Besides keeping members informed of the progress, so they do not have to call will significantly improve the loyalty and the ultimate the bottom line. So all these things proves that the call center is very essential part for the healthcare sector. Now let's move to the next topic. What is telehealth or virtual healthcare? To provide any type of healthcare services, a patient and a doctor connect via an electronic or telecom based communication channel. They discuss symptoms, causes, etc. And in many cases, doctors are also prescribed medicine for further medical tests that need to be conducted. During this whole medical consultation, neither doctor nor the patient visits the hospital or each other. Everything is conducted remotely and patients are diagnosed and medicated remotely. This concept is introduced by identifying physical areas and some disease like COVID-19 in which it is difficult for a healthcare facility to reach people that need healthcare services. But now it is used in urban lifestyles to have regular consultation with the doctors or first aid for sickness, etc. So that is the telehealth, or we can say the virtual healthcare. Now let's see the next topic. What are the essential characteristics and the features that the healthcare call center solution must have? A contact center solution is a common term, and when this term buzzes our minds, we think about a software solution with some predefined features. Remember, all call center solutions are not a healthcare contact center solutions. A contact center solution must have some essential features and comply with major compliances to provide virtual healthcare services. Let's explore the top five must-have characteristics in the call center software. First one is HIPAA compliances. HIPAA stands for Health Insurance Portability and Accountability Act, which was passed by federal law back in 1996. It emphasized on the privacy of patient and other healthcare data. Your healthcare contact center software needs to be HIPAA compliant if you want to provide healthcare services to patients in the USA. In many other countries, this compliance is accepted to ensure the confidentiality of patient data. Second one is medical emergency call handling. All call center solutions provide different automatic call distribution rules to route the calls of a patient to the right team or doctor, and also it would have a call queue to put a patient on the hold until he or she gets connected with a medical representative. But What is the more important in the healthcare call center software solution is emergency call routing. If a patient needs an emergency service, his or her call has to be given priority to deliver on-time healthcare to save more lives. Your software must have either priority call routing or extension calling feature to support this need of healthcare facilities. Third one is connect with the same doctor. Many patients use virtual healthcare as a relief to get the remote medication and consultation as either they have physically unfit to visit a doctor on their own or they are leading very busy life. Unlike a normal scenario of a call center in which the software for call centers connects the caller to any available agent in the telehealth scenario, patients prefer to consult with the same doctor. Your healthcare call center system must have this feature like a sticky agent to connect the patient with the same doctor again and again. The fourth one is send emergency alerts on or healthcare notifications. A contact center software solution that will be used in a virtual healthcare facility needs to handle emergency situations as well. For example, telehealth is not sufficient and patients need to be brought to the hospital to provide emergency care. In this case, the hospital call center software needs to send an alert to respective staff to handle the emergency such as ambulance driver, first aid team, physician, etc. To attend to the patient and provide the right care, a voice broadcasting solution and the SMS broadcasting system integrated into the software for healthcare can help here to send emergency alerts and notifications to the handle situations better and save more lives. Fifth one is digital engagement with omni-channel communication for better patient care. Some patients may prefer other communication channels such as WhatsApp to get medical attention such as a depressed person. In this case, digital engagement is necessary to provide medical attention and services. Even sending casual healthcare reminders like the next telehealth call appointment needs to multiple communication channels like SMS. Thus, an omni-channel contact center solution is a must in the healthcare facility that uses the telehealth phenomenon. So these are the characteristics. Now, to fulfill those characteristics, we have a list of features in our iQualify. Let's have a look on some of the major features. First, lead management. Leads, or we can say patient data, is most important thing in any call center solution. Without lead management, call center solution is like a skeleton without a mass body. And as we have talked about the HIPAA, we have a lead management feature in iQualify where you can store all your patient data and also you can manage the call notes and comments made by agents or doctor for any of the particular patient. Also, when the agent or doctor will make or get a call from any particular patient, he or she can see the patient's data along with comments and previous call notes. So from that, he or she can get the idea about the previous conversation with that particular patient. So lead management is must required feature. After that, we have a department module. In the hospital management, there will be a different department. So your call center solution must have a department management. So every department can see only that department data. You can create campaigns, call queues, and your agents or doctors department wise. So they can attend only those departments call and can see only that particular department data instead of unnecessary calls and data of other departments. As you can have many departments like OPD, medical department, nursing department, pharmacy department, etc. You can create every entity and users department wise, and that department user will have to access only for that particular department's data only. You can create deeds for every department. So whenever any of the person calling any particular deed, it will be going on that this department only. For example, a person wants to connect with the pharmacy of your hospital. Then they will dial the number which you gave for the pharmacy. So call will only go to the pharmacy departments and it will save the time of patients and the hospital to transfer the call to the other departments. So the department management is also important in healthcare call center solution. The next feature is Webform. Nowadays, most of the hospital management has their own CRM where they are managing the patient's data and they want to sync up the data between call center solution and with the CRM. So we have a Webform feature for that where you can set up your CRM URLs which can contain the form where agents or doctor can fill up the details for that particular patient according to his or conversation with patient, and you can get that data directly into your hospital CRM. We have two options for Webform. First is agent or doctor can click on the Webform button while call is running with the patient and the Webform will pop up. The second option is get call launch where the Webform will automatically pop up whenever the call will start with an agent or doctor. Webform you can configure in the campaign settings. Next feature is in list is broadcasting. Calling a thousand of lead one by one manually for giving some general information is a tedious task. So many organizations in the healthcare industry are starting to take advantage of innovative communication technologies like broadcasting solutions. Implementing broadcasting solutions like SMS broadcasting, email broadcasting, and voice broadcasting in your general practice, clinic, hospitals, or other healthcare organizations can help to instantly improve communication with patients and employees. Broadcasting allows you to reach audience of one up to thousands of people at once, quickly and reliably. In particular, healthcare providers are embracing the use of broadcast to update the patients and employees all at the same time and for the increasing communication and productivity in the workplace. In our iQualify, we have a voice broadcasting solution in which we can set up the IVR, and with that, hospitals or clinic can update the patients regarding the new notification or any new announcements. Also, there is a provision of SMS and email broadcasting which helps to send alerts on patients' mobile phones or email IDs to keep them updated regarding hospitals or clinic schedules. With the IVR option, patient can press any of the available DTMF options to transfer the calls in different route. We also have the break time facility under the voice broadcasting campaigns. We stop the campaigns to send the calls at a configured time of break. Then we have a callback notification. Callback notification today has become a very important part of customer experience. Automated callback notification helps in reducing cost and help agents work more efficiently by giving customers a specific time windows for their callback. In our call center solution, agent can choose disposition of callback after the calls get hang up. This is to schedule a call for future communication with patient to give them a gentle reminder for follow up or prompt them regarding their medicines or healthcare reports. And the feature custom fields plays a vital role keeping record of patients. In our system, there are various predefined fields which are required to save the information of patients, but there is additional amenity for adding custom fields which can be configured by the healthcare sector themselves according to their need. They can change the existing field with their custom field labels according to their requirement, and this helps them to create their own customer information page and store the patient's data as they want. After that, we have the as we discussed about to connecting with same doctor, we have a feature of sticky agent. This feature is helpful when patients is calling at hospital or at clinic very frequently, and they want to connect with the same doctor every time, and with them they do not have repeat their problem again and again to different doctors. We also have the provision of sticky override. It comes in the use when any of the patient calling to the hospital or at clinic and he or she is sick with any doctor, but that doctor is not available at that time, then call will go to the another doctors and they can have an option to override the sticky doctor for that patient. So that patient will stick to that new doctor. We'll also have a provision to define the number of days for sticky agent. So after that number of days, patient will be unstick from that doctor. After that, we have a call queue configuration with ACDs. ACD stands for the automatic call distributions. Call queues are getting used for the incoming calls and can set up the ACD for the call queues according to the requirement. ACDs are the algorithms that decided to which agent or doctor to pass the calls. We have many ACDs available in iQualify, like round robin, in which call will be passed to agent or doctor one by one. Second is random, where it can pick any random agent or doctor, which available to take the calls. Then we have a rank wise ACD, where higher ranks agent or doctor will get call first if they available, and then to the lower rank agent. This also called the priority wise calling. Also, we have a few more ACDs available that you can check by yourself in iQualify. We also have an IVR options where you can set your prompt or we can say sounds file which you want to make your patients to be listen while they are answer the call of voice broadcasting. Also, you can set IVR in date route option where you can put any number of options to send the call on another route that's selected by patients via DTMF. Now, apart from these features, our iQualify is also an omni-channel call center solution. In that, we have WhatsApp, Facebook, Twitter, chat, etc. As we discussed in characteristics about digital engagement with omnichannel communication call center solution, must provide the digital omnichannel features as nowadays patients and doctors are using the digital channels to communicate with each other. For an example, with a WhatsApp, patient can message at clinic or hospital to know the timing and the availability of doctors. So they no need to call at hospital or at clinic. Also, doctor can notify the patients regarding any announcement by sending the message over WhatsApp. Nowadays, many clinic and hospitals sending the patient's report in WhatsApp itself. So it is saving a lot of time of patient and also use of the papers. And patient does not have to need to visit clinic or laboratories to take their reports. Also, patients and doctor can do conversation over Facebook and Twitter also. Now, apart from these major features, we have other general call center features along with the reports. So that's it about the features. To know more about iQualify features and the solutions, you can visit our website iQualify.com. Also, you can try our free version of iQualify. So that's it about today's webinar. Now we will have a question and answer round. If you have any query, you can ask it here in comment box. Looking for the first query. If you have any query, you can ask in comment box. Okay, so since no query from anyone. Okay, so we can conclude here. If you have any query, you can ask in our forum as well. We have a forum called we have a forum called forum.iqualify.com where you can ask your queries. Okay, so thank you for joining us and goodbye.